students, so we will continue with next condition. So this is video 8. So I think we have done with urinary incontinence. So far 2 conditions we have seen. So now we will see with urinary tract infection. So what is urinary tract infection? A urinary tract infection is an infection that affects part of the urinary tract, okay, and then it gets infected. So what are the causes? Urinary tract infections are caused when microbes manage to get past the body's natural defenses. So normally there are natural chemicals that are found, okay, which will prevent the entry of the microorganism, but when it breaks that natural, the chemical barrier, and then if the microorganism enter, which leads to the infection, okay, then it causes urinary tract infection. So what are the various causes? The vast majority of UTI causes are caused by the bacterium E. coli, Escherichia coli, usually found in the digestive system. Okay, so so this is caused by E. coli, or it can be caused by chlamydia and mycoplasma bacteria, which can infect the urethra but not the bladder. So it infects the urethra, this chlamydia and mycoplasma, it infects the urethra but not the bladder. Then people of any age and sex can develop a UTI. However, some people are more at risk than others. Okay, so some people are at high risk. So these are the main 2, E. coli, chlamydia and mycoplasma. It can affect of any age group and sex, okay, and it can be high risk than others. Okay, some people are prone to have many frequent times of UTI. Now we will see what is the pathophysiology. So already a diagram is given, so please go through that. So whenever there is an entry of the pathogen from down, you have to see, okay, the pathophysiology goes like from downwards to upwards. So pathogen colonizes the periurethral area and ascends throughout the urethra upwards towards the bladder. So what is happening? The entry of the microorganism leads to colonization, where there is a multiplication of the organisms. So it colonizes the periurethral area, so around the urethra, and it ascends through the urethra. So around the urethra, it enters into the urethra and it goes upwards towards the bladder. Okay, then what happens? Uro Epithelium Penetration happens. So in that, what it is? Fimbria allow bladder epithelial cell attachment and penetration. So we will see that this fimbria will allow the bladder, okay, that is the microorganism epithelial cell attachment, and gets penetrated. Then following penetration, bacteria continue to replicate and may form biofilms. So what happens? It enters into the epithelium of the urethra, okay, and then it starts proliferation, it starts multiplying there, and from there again ascension happen. Okay, ascension is again moving forward. So once sufficient bacterial colonization occurs, bacteria may ascend on the ureter towards the kidney. So from the ureter, now it is already multiplied, and all the multiplied organisms are moving towards the kidney. Fimbria may aid in the ascension process. So these microorganisms will be having the moving structures, fimbria, so that will help them to move forward. Bacterial toxin may also play a role by inhibiting peristalsis, that is, it reduces the flow of urine. As it is getting infected, the urine flow also becomes less or scanty. So after this ascension, it enters, it leads to the condition pyelonephritis. So infection of the renal parenchyma, okay, the tissues of the renal is getting affected, causes an inflammatory response called pyelonephritis, that is the inflammation of the kidney. Then while infection of the renal parenchyma is usually the result of bacterial ascension, it can occur from hematogenous spread. Okay, so automatically it affects the blood also, and then later stage it leads to acute kidney injury. So this inflammatory cascade continues. Then what happens? All the tubular obstruction happens and the damage happens, leading to interstitial edema. So there is a edema that is formed within the kidney. So inflammation happens, then there is an edema, then this may lead to interstitial nephritis, causing acute kidney injury. Okay, so urinary tract infection, the entry of the microorganism around the urethra, then colonization happen, it enters into the urethra, and then we see it enters into the Uro Epithelium Penetration happen. Okay, so there again the bacteria starts multiplying, and then these fimbria, it helps into the ascension. So because of the ascension, again bacterial toxins, it plays a role by inhibiting peristalsis. So further ascension into the kidney happens. So meanwhile what happens, the urinary output also comes down, then it leads to pyelonephritis, that is the renal parenchyma gets infected, leading to inflammation of the renal parenchyma and inflammation of the renal, okay, that is the kidney, and then it affects the kidney, leading to acute kidney injury. That happens because of damage, okay, that is caused, and the edema, interstitial edema. So this leads to interstitial nephritis causing acute kidney injury. So this is the pathophysiology for urinary tract infection. Next we will see the risk factors. So when we say risk factors, we have sexual intercourse, especially if more frequent, intense, and with multiple partners or new partners, then it can lead to urinary tract infection. Diabetes, because they will be passing urine all the time, polyuria will be there, so proper hygiene is required. If they don't maintain the proper hygiene, then they are prone to develop urinary tract infection. Then you have problems emptying the bladder completely, okay, that is incontinence again. Then having a urinary catheter, indwelling catheter, bowel incontinence, okay, so fecal matter also, if they are passing all the time, there are chances for the urethra to get infected with the fecal matter. Then you have blocked flow of urine, then kidney stone, some form of contraception, okay, pregnancy, menopause, procedures involving the urinary tract, suppressed immune system, immobility for a longer period, use of spermicides and tampons. So these spermicides are contraceptive ointments which are used to kill the sperms, okay. Tampons are used, okay, for during menstruation, okay, it is inserted into the vagina, okay. Heavy use of antibiotics which can disrupt the natural flora of the bowel and urinary tract. So high antibiotics actually kills the natural flora, natural good bacteria, so it allows the microorganism to enter, leading to urinary tract infection. Then you have symptoms. Coming on to the symptoms, you have strong and frequent urge, okay, they will have an urge to urinate. Then they will have cloudy or bloody, strong smelling urine, pain or burning sensation when urinating, burning maturation will be there, nausea, vomiting, muscle ache, abdominal pain, and high fever also will be there, okay. It is not mentioned, please write down. High fever will also be there in the patient. Then people with catheter may also experience fever as a symptom, making diagnosis problematic, okay. Now diagnostic test, history collection, physical examination, then do a urine culture test, the diagnostic imaging like X-ray, MRI, CT can be done. Urodynamics, it is a procedure that determines how well the urinary tract is storing and releasing urine, so that is urodynamics. Then cystoscopy, visualization of the bladder, okay, so it is inserted via the urethra to visualize the bladder. So these are the various diagnostic tests that can be done for urinary tract infection. Then talking about management, pharmacological therapy, so you have trimethoprim or sulfamethoxazole, Bactrim, Septra, others are given. Then you have phosphomycin, Monural, nitrofluorination, macrodantin, macrobid, ciprofloxacin, levofloxacin, ceflaxin, ceftriaxone antibiotic, all kinds are given, azithromycin, okay. So remember few antibiotics, then you can write. So these are the drugs that are given for the patient who are suffering with urinary tract infection. Now coming on to nursing management, so we will see, first thing is we have to reduce the pain. Patient will be having severe abdominal pain, okay. So monitor urine color changes, monitor the voiding pattern, intake and output chart every 8 hours, and monitor the results of urine analysis reported. So if we are not still sure that the patient has got UTI, so we should be able to find out, okay, what is the what are the symptoms that the patient is exhibiting, and then how we can give further treatment. So make sure that you collect the reports of all the urine analysis, X-ray, whatever you have taken for the patient. Make sure that all the details are kept ready, Okay, then you have to note the location intensity of the pain scale 1 to 10 pain scale you can use. See the facial expression, that is what is pain scale, and note the location where exactly the patient is having. Sometimes they will have lower back pain, okay, where the kidneys are located, so we should ask them where, or lower abdominal pain will be there, so ask them where is the pain, and intensity of the pain has to be assessed using pain scale. Then provide convenient measures such as massage you can give perineal care. If using a catheter treatment 2 times per day, so we have to give catheter care, taking it is a sterile procedure. Give perineal care and clean the catheter because of indwelling catheter if the patient has developed urinary tract infection. Then divert attention to the fun, like you can give diversional therapies. So when we talk about diversional therapies, what are the many types of diversional therapies you can give? Ask them to hear to music, okay, reading books, okay, and then trying to talk and ventilate their feelings. You can be very openly talking or encourage fun, so everything should be in a positive way and in a healthy manner. Then collaboration of analgesics. So as per the physician's order, we have to give them analgesics so that their pain will be reduced. So these all comes under reducing the pain. Secondly, improve urinary elimination pattern. So we have to assess the patient's pattern of elimination, how many times they are passing, is there any kind of incontinence or burning maturation. Then encourage the patient to drink as much as water, reducing drinking in the afternoon. Okay, so they can take little amount in the night as well as in the afternoon, but ask them to take as per the prescription. They should take adequate water. Then we have to encourage the patient to urinate every 2 to 3 hours. Okay, and when it suddenly felt, whenever they feel like voiding, ask them to go and void. Don't ask them to withhold the urination. Then prepare encouragement to do perineal care every day. So through which we can actually improve their urinary elimination pattern. Next, talking about improve sleep pattern. Patient might have lack of sleep. Okay, so we should encourage them to sleep properly. So determine the usual sleeping habits and changes. Provide a comfortable bed for the patient. Increase comfort bedtime regimen, for example, a warm bath, a massage, a glass of warm milk. Reduce noise and light. Instruct relaxation measures. So you can actually determine, ask them how long do they sleep, what is their sleeping pattern. You can give them a comfortable bed, wrinkle-free bed. Ask them if they want to do some meditation or if they want to take a warm bath. Give them warm milk to drink. Lighten all the, switch off the unwanted light or put a dim light. Keep their surrounding neat and clean. Okay, and then you ask them to meditate or read some books before going to sleep. So these are all the ways how we can improve the sleep pattern. Next, maintaining body temperature. So very important. Now you assess any complaints or signs of increased body temperature. Observation of vital signs, especially temperature as indicated. Warm water compress on the forehead and both axilla. Collaboration of antipyretic drugs. Okay, so you can assess, so care of fever, right? So assess, find out, assess the temperature, and then you provide a cold compress. If you like very high fever, you can use ice or cold water, or if it is at the night time, you can just take little warm water, tap water, and then you can give them. And then encourage them to wear, if they want fan, you can put fan. Give more cross ventilation, and then give cotton clothes. Ask them to take fluids. Okay, so by this we should be able to manage. And at the last, as per prescription, we have to give antipyretic drugs to the patient. Okay, so these are all about urinary tract infection. We have seen the definition, what are the causes, then pathophysiology, what are the risk factors, in whom it can develop, then symptoms, then what are the diagnostic evaluation, management. We have seen pharmacological therapy, mainly we have all the antibacterial drugs, and then nursing management. Okay, reduce pain, urinary elimination, improve sleep pattern, maintain body temperature. Okay, so with this we are completing the topic of urinary tract infection. So next video we will see with acute glomerular nephritis.